like to use the analogy of a car. If the car is making a bunch of noise, it's best just to turn up the radio. And that's what we do. That's our training, is mask the pain. Very rarely do we find the underlying cause of the pain.
There's so many neat ways to take care of pain where you don't have to go and kill yourself either with an opioid or one of those toxic over-the-counter medicines. People think they're safe just because you don't need a prescription. They're not safe.
We're perfectly matched up or in unison with the benefits of the cannabis plant. The medical community actually is now recognizing this. So in 2004, they've identified we have a body system called the endocannabinoid system. And when we don't have cannabidiol in our daily diet, we end up being in a deficiency state.
You can't go anywhere without seeing the CBD dispensaries or seeing it online. It's very, very popular right now, and for good reason. Both the scientific evidence and the real-world evidence shows considerable promise, and it's really encouraging to me because when you start to look at opioid statistics, sleep med statistics, it's concerning, and they're going up.
People with deviated septums, people with sleep apnea, people with migraine headaches. I mean, there's a lot of different applications for this procedure. This is not the most pleasant procedure to have done, but it's a heck of a lot easier than surgery. Take a deep breath in, tongue out, hold tight. Great. Okay.
Welcome to episode 7 of Pain Revealed. As you can see, we've covered a lot of ground, and we're in episode 7 of 9 for this entire docuseries. So we have a few episodes left to go. For the people who have already invested in Pain Revealed, thank you. It supports us, it supports our mission, it helps us continue to do the work that we do. And if you haven't invested yet, I want you to strongly consider it. During this free viewing period, it's steeply discounted, and it's something that I believe can have a high impact on your life and maybe the lives of other people that you care about. So let me encourage you to pick the right package for yourself, invest in this project, and you're going to find that it's going to pay dividends into your future. Now, we've got a lot of great content here for you in episode 7, so let's dive right into it. Make sure that you're leaning into it. Have your pen, your paper, whatever you need ready to take notes. There's some great content coming your way, so let's go. I hope you're ready to laugh. We're going to have an interview with two very serious doctors, but they also have a great sense of humor. This is Dr. Jason West and Dr. Warren Willey, and the work that they're doing at the West Clinic is staggering. People travel from all over the world to get there, and I think you're going to understand why in just a few moments. Jason, Warren, thanks so much for sitting with me.
Yeah, of course.
Thank you.
So am I sitting across some doctors or a comedy team?
Yes.
One of the same, absolutely.
Absolutely.
You guys seem to have a lot of fun together.
We
I
do.
see you cutting up and interacting and so on. So let's talk about who you are and what you do. I'm going to start with Warren.
Sure.
So give us your background.
Well, I'm a traditionally trained physician, an osteopath, trained in Kansas City all early 90s. I went to the Mayo Clinic for a family medicine residency, and then did a lot of outside training in what would be called alternative medicine. I call it more functional, real-life medicine. And my approach to health is, let's look at the whole person. I think in Western medicine, I was trained in boxes, but really everything's connected.
Yeah.
And we're talking lifestyle, spiritual, mental, emotional, relationships, diet, exercise, medicines, hormones. I mean, you got to look at the whole person to understand what's affecting them or afflicting them, and then how to optimize their quality of life.
Awesome. Jason?
So, fourth generation chiropractor, all I wanted to be was to be just like my dad. And then when I got into practice with him, I recognized that he was this amazing healer. And I asked him, Dad, how do I do what you're doing? And he said, well, you haven't paid your dues yet. School teaches you to not be a menace to society. Anybody can be a doctor, but if you want to be a healer, you got to listen to here.
Right.
And then it was, okay, keep going, acupuncture, naturopathic degree, clinical nutrition degree, and just kept adding to it. And then, you attract people into your life for different things, and we lined up and we started working together.
Now, the West Clinic has existed in Idaho how long?
January 1916.
1916
is when we started.
1916.
Yeah,
He wasn't there yet.
Actually, I do. I practice what I preach. I'm actually, 150 years old.
You look great for,
Yeah.
for
Hey,
us.
I'm your anti-aging doc.
Exactly. Yep. I was looking old. I did some stuff with Warren. Look at me now.
So this is great. And when did you join the West Clinic?
We've been working together about 18 months.
Yeah.
Yeah.
And has this been something pretty radically different for you, a departure from what your typical practice was prior?
No, because our philosophies are so similar. It was
For sure.
the second we really met, we knew of each other for years.
Mm-hmm.
I think I've always respected what he did. I think I got the same respect back from him, but we were in different worlds.
Mm-hmm.
And when we got the opportunity to cross, we were both like, holy cow, we have identical philosophies, identical goals for people. Our approaches are a little different based on our training, but our beliefs are the same.
Yeah. Now, what's interesting is I know that the West Clinic has specialized in some respects to really chronically ill people who typically fail in the medical system as far as getting their health back. Mm-hmm. And there's no shortage of those, as we all know. With that, a lot of these people, I'm sure, are coming in chronic pain. And, the subject that we're really wanting to explore here is pain, the nature of pain, maybe the philosophy or perspectives that you might have around it. What you feel like, is wrong in traditional pain treatment and how you guys approach it. So I know it's a lot, but let's just start there. What kind of people show up at your practice that are having varying types of pain issues?
Geez, all of them?
Yeah.
I mean, and not like necessarily like debilitating chronic pain, but everybody's hurting.
Yeah.
Yeah.
And that is their underlying thing. I mean, I think first for me it was fatigue, but then we have so many people that are like, hey, I got a bone-on-bone arthritis, I've got a back problem, I've got chronic migraines, and then that hits the whole cascade, because I like to tell people, or at least explain to them, the reason why you're sick is because you run out of energy. And one of the reasons why you run out of energy, it takes so much energy to be in pain. Mm-hmm. And pain just sucks your soul out. Mm-hmm. And then we're taught wrong. And when I say we're taught, on my side of the fence, we're taught wrong, because one of the worst things I think that you're taught, at least on my side, is the visual analog scale. Mm-hmm. I think that's the worst thing that we teach people. What's your pain today? On a scale of 1 to 10. Is it a 9 out of 10 or a 10? And what we're reinforcing to people is pain, 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 pain. That's the worst thing that we can do for people. Mm-hmm. What I like to ask people is, what have you lost? Right. And people are like, what are you talking about? I'm like, look, you tell me on your intake that it's shoulder pain. It's not shoulder pain. That's not what motivates people to get better. They're saying, I can't sleep on my side, I can't hug my spouse, I can't throw a rock, I can't golf, I can't do that. And if you focus on that and saying, look, let's get what you lost back, then the pain discussion goes away. If you sit there and every visit say, what is your pain, what is your pain, what is your pain, then they're like, well, I just want to get my pain away. I want to go get it over the counter. I want to go get an opiate. I want to go get something that will get rid of my pain. It's not pain. That's the whole problem with pain, is when we focus on pain. We got to focus on what you lost and your function.
With your training at the Mayo Clinic, when people came in with pain, what were you directed to do?
We like to use the analogy of a car. Mm-hmm. If the car is making a bunch of noise, it's best just to turn up the radio. Mm-hmm. And that's what we do. That's what we're taught. We're trained to mask the pain. Mm-hmm. If my foot hurts, I give you a drug that works in your brain. Shouldn't I be concerned with the foot? Yeah. And so that's our training, is mask the pain. Very rarely do we find the underlying cause of the pain. And I couldn't agree more with Dr. West that we focus so much on pain. I think in America, pain is a very cultural thing. If you go around the world, especially in Latin America, where I'm more familiar with, pain's a very different phenomenon down there. How they view it as a cultural thing, how they view it, how they treat it, how they amend it, how they deal with it on a personal level, be it spiritual, be it relationship, being the family coming around the person in pain. Here, we run right to the doctor and want a drug. Mask it, cover it, it'll go away eventually. Does it?
Well, as you're talking about all these dimensions of life, I find that very often people create self-identity around the pain, right?
Absolutely.
In other words, it's my back pain, my sciatica, and they literally self-identify with whatever that is, which starts to make them sort of a victim, which I imagine is somewhat disempowering. So how do you handle that part of it?
Well, you have to get real with them, and you have to say, look, there's 5 barriers why people don't get better. There's a financial barrier, there's an inner circle barrier, there's a self-sabotage barrier, there's a genetic barrier. I mean, there's all these things that prevent people from getting better. And one of the hardest things I found out as a doctor is there's people that don't want to get better. They'll tell you that they do, and they'll come into the office and they'll say, hey, I'm totally getting better, I'm gonna do this, and you'll look at their update sheets and they'll be like, hey, I'm better, and then you do a reevaluation, they're like, I'm worse. I slid back, and you're like, wait a minute, for the last 8 visits, you're saying that you're getting better. And I think part of it is because they become their identity. They become their disease, and they're like, hey, Dr. West, I could have been president of the United States. I could have been an astronaut. I could have been the governor. But because I have fibromyalgia, or because I had trauma to my knee or to my back, it's taken over my life, and it empowers them to sabotage them. It doesn't empower them to get better. And so a lot of times people don't even know that. They're subconsciously sabotaging themselves. And if you help them to at least be aware of it, sometimes you can break through that barrier.
So that must be tough for people to hear sometimes, I imagine, because so if I were to ask you this question, how much of the outcome, as far as a positive outcome, is dependent on what you do, and how much is dependent on the patient? What would you surmise?
I would say it's like a good marriage. It's 100% of each of us.
Good answer.
We have to.
Everybody has to give it their all.
Everybody has to give it their all.
But if you're giving 100% and they're only giving 20%, or maybe they're giving negative 20%, that could be a real problem.
That can be a little more difficult and a little longer. And that's when I know in our practice, we try to step back and be honest with the people, see what, part of it's back to that culture. Mm-hmm. Not only are they living in their pain, but so is everyone around them. And there's an old saying that, boy, Mrs. Jones sure enjoys her illness. Mm-hmm. And what basically we kind of joke about in our office is that's their identity, that their friends, their coworkers, their family, their kids, their pet cat realize that this pain lifestyle is the way they live. But I don't know if they ever realize that. So one of the first steps, like Dr. West said, is sit and visit with them and be honest. Hey, we're doing everything. This is it. We're going after the underlying cause of your pain. We're not just going to put a bandage over it and wait for it to fall off. We're going to go after the cause, but part of that's you understanding the mechanisms behind it.
Well, let's talk about maybe some specific examples then. I know one of the areas that you play in many areas as far as people who come to you with very tough challenges. One of the areas that I think you've had a great deal of success in is rheumatoid arthritis, for example. Those people are in a great deal of pain and typically are taking very toxic medications in trying to not solve, but at least manage their life with the problem. Mm-hmm. So how do you see rheumatoid arthritis, just as an example, and what do you do to help solve their problem? Okay, so first of all, with rheumatoid arthritis, one of the biggest misunderstandings about it is it's not autoimmune. Mm-hmm. And I've talked to rheumatologists, I've talked to medical people, and this is why I love working with Dr. Willie, because he doesn't have this on him. Because the reason why I say that is because I think that you get an infection in the joint, and what happens is the body doesn't have quite enough horsepower to get rid of it. So it sits there in a chronic inflammatory state, and the medical treatment is, okay, let's just remove inflammation, let's put you on modified chemotherapy, and quote, knock out your immune system, and then I don't see really good outcomes with that. And one of the things that we do is like, hey, let's upregulate your immune system. Let's get rid of the infection and see what happens. And so we give them massive amounts of IV vitamin C. And if it was a true autoimmune, what would happen is they get worse. And they don't get worse. I mean, we've got hundreds of video testimonials of people with rheumatoid arthritis, with Sjogren's disease, with multiple sclerosis, with lupus, and you make their immune system work by balancing everything in their life. And it's not just vitamin C. It's relationships, it's sleep patterns, it's foods, it's everything that their hormones is balancing everything out. And when you do that, when you balance people, all of a sudden their symptoms remove.
and they go away, and they'll go tell their community or their medical doctor, and they'll say, hey, my symptoms went away. And that's so funny, because we just had this happen with a case where the patient said, hey, my doctor told me that I just have LDA. And I'm like, well, what is that? I've never heard of this before. And he just said that we were lucky. You went over to your office, and now I have low disease activity. It's spontaneous remission. And I'm like, okay, I don't care who gets the credit, for sure. And other people come in and they'll say, well, my doctor says that you guys can't really do that. And I always say, it is true for that guy. He can't do it. But if we put the function together, I mean, rheumatoid arthritis is one of our favorite things to treat.
And those are people who are really struggling and suffering quite a bit. So this sounds like there's a bit of art to this when it comes to the, how can I put it, the more non-clinical dimensions of what you're doing. And how do you harness that? How do you go after that? Like with somebody's maybe psychological or spiritual challenges they might be having that might be impacting all this.
Well, I think it's important, again, to try to understand the underlying cause, and using rheumatoid arthritis or autoimmune disease as our example. It's not an overactive immune system. It's an immune system that was steered wrong. And almost universally, if you sit and talk to someone about when that rheumatoid arthritis started, you'll get a trauma history, be it psychological, be it emotional, be it physical. Something triggered the immune system to turn. And so the approach, understanding that philosophy, is not to suppress the immune system with a bunch of powerful chemotherapeutic drugs like Dr. West mentioned, but step back and look at all the aspects of the person. Gut health, hormone health. I mean, hormones are so important. The autoimmune disease is 10 times in women to men. Well, there's got to be a hormone thing going on there. Understanding relationships, understanding stress, understanding the effect of cortisol, the stress hormone, understanding their movement history, what crosses their lips, be it processed food or organic food. There's that bigger aspect. And when you can sit and approach someone in chronic pain with that attitude and with helping them see there's an underlying cause here, and we're not just going to put a Band-Aid on it, we're going to look at you. We're talking hair follicle, even if you don't have much, to toenail. Let's look at you. But not only you, let's look at all your influences in life. Let's look at those relationships. Let's look at your spirituality. Let's look at your how much time are you watching TV? I mean, there's so many variables, but you can get to that if you understand the underlying issues, the underlying cause of it.
So we talked a bit about chronic pain scenarios and how you view those and how you might approach them. What about acute pain? I mean, people who showed up and it's pretty severe, it's recent onset, and what's your perspective on that and how do you handle it?
Well, first of all, we recognize no one wants to be in pain. And I had enormous empathy understandings coming in when I kind of abused myself and I got a kidney stone. And oh my gosh, did my perspectives change about pain, because I've been taking care of people for 20 years, and then all of a sudden I'm like, hey, I've got something going on. And recognizing sometimes we have to do a short-term intervention to get people through that, but not always. So if it's a headache, if it's a back problem, is there a biomechanical distortion that we can fix first? So always look at joint. Can we do something in the muscles? Can we do something in the nerve pathways? And then can we get a nutritional foundation in place quickly? One of the things we found is if we combine essential fatty acids and a proteolytic enzyme, we can mimic all of the effects of aspirin, Aleve, and naproxen without all the side effects. It doesn't start immediately. It takes about 3 or 4 days for that to kick in, but you can totally manage pain naturally without having to use over-the-counters. And it's so fascinating for me to people who come in and they'll say, well, I just take these, benign Tylenol. Like, they're not benign. Advil is not benign. Aspirin is not benign. And they take it like candy. But if you can institute that and you can get them out of that, short-term crunch, and sometimes we'll use acupuncture or neural therapy without having them to get into those heavy-duty, drug pathways, we can almost always get on top of them and resolve long-term things. So chiropractic manipulation, physiologic therapeutics, acupuncture, neural therapy, prolozone therapy, some vitamin injection therapy. And then one of the neat things that you were talking about, acute pain, I think so much on the pain side has to do with the doctor's ego. And if you get rid of the doctor's ego, then you get miracles. So you were asking me about art.
Yeah, you're going to have to tell me a little bit more what you mean by that.
Okay, so doctor's ego, it means this, is sometimes the doctor's ego doesn't allow people to get better because they want to be the guy, or it's their treatment protocol or whatever else. And when we established our clinic system, where we have the doctors and stuff in our program, in our clinic delivering care, we make them come up with their own patient promise. And the patient promise is, we don't care who gets the credit, as long as you get better. And so we're always dialoguing, we're working with our naturopath, our nurse practitioner, each other, on what we can do for people. I learned that from the greatest doctor of all time, which is my dad, and I'm totally biased when I say that. But he taught me something really important about healthcare, and that's this. Anybody can be a doctor. You just gotta sit, you butt time in class, you do your 10-year stretch, you can come out with a good degree. So anybody can do that. You just have to have a commit to that pathway. If you wanna be a healer, you have to listen to hear. And so much of that is being willing to take what you thought was going to work, and then me going over to Dr. Willie and say, what do you think about this? And him expanding our repertoire, or us going to our nurse practitioner or our acupuncturist and saying, what do you think about this condition? And getting everybody's input, and then having the humility to say, well, maybe my plan isn't the greatest plan. Maybe it's Dr. Nelson's plan, maybe it's Dr. Willie's plan. And if you can put all of that together and just concentrate on people getting better, now so many health problems now melt away. And when we started working together, like, I have unbelievable respect for his hormone prowess, his weight loss, how he's doing these functions, changing people's lifestyles. We added that, and I added some of our, alternative medicine. And now when people come into the office, we have an encyclopedia of ability to treat people. It's not just our pathways anymore, it's all of it. And so many times, doctors' egos get in the way of getting people better.
Well, it sounds like the priority is getting the patient well. And rather than saying I'm feeling envy or jealousy because somebody had a better idea or had more effect than me, it's being grateful for the fact that they were able to step up and get the job done.
Absolutely.
So that's a team approach as compared to the individual star approach, I guess is what it sounds like. So it's really interesting, and that's a culture I imagine has to be created, right? Because I can tell you, from a lot of years in practicing in chiropractic, that when I was successful with patients in care, that other practitioners who weren't successful were angry at me or kind of tried to explain it in some other way as compared to what you're talking about, saying, well, wow, I'm really glad Mrs. Jones got the care she needed. So it must be great to put together the team and say, hey, we're all just rooting for the patient, and however we get there is all that matters.
Well, we just visited with a patient earlier today, had a chronic brought in a gazillion supplements, a gazillion prescriptions, been to 13 doctors, and she was saying, well, what do I take about this? Well, do I do this treatment? And my response to all of it was, well, do you perceive benefit from that? And she's like, well, I don't perceive benefit from this thing. Okay, this is really easy. And we took a waste paper basket over the shelf. We went like that. And she's like, why are you doing that? I'm like, it didn't work. And if you want us to dial in, and she said, well, I go to this, upper cervical chiropractor. I'm like, okay, do you perceive benefit from that? And she's like, absolutely. I'm like, this is easy. You should keep going to him for that. What about your stomach? Oh, it's, my stomach's a mess. Okay, we're going to help you with this. Go see him for that. All we care about. And if we can get to the point where, and Warren and I have talked about this, if you get to the point where you kind of don't care what anybody else thinks, you just put the patient first, you get to a dangerous level of helping people, because it doesn't matter. I used to be so worried when people would be like, hey, well, my real doctor said this. And I'm like, okay, what am I, your fake doctor? Like, what you're telling me that. And then it got to the point where it doesn't matter. It doesn't matter what they think, because I'm not trying to treat them. I'm just trying to get you, and we're just trying to put our heads together. And that's when I was just like, egos don't matter. I heard a quote the other day. It says, men never come closer to being gods than they do by delivering health. And it's such an unbelievable personal satisfaction feeling when you help someone that says, hey, I've been to this institution or that institution, and then we come to you guys, and I'm like, look, I don't care who you see in our clinic system, as long as you get better.
So with the population you see, I imagine it is the spectrum, right? From children all the way up to geriatrics?
Just when you were born and then right before you die. Of course, we don't make them die, but I had to clarify that. But yeah, the spectrum is, look, if you have a healthcare problem, you should come check us out.
And what would you say is the biggest challenge that you have when you're dealing with pain, whether it be chronic or acute, as far as getting the patient to comply with
these things that you do that are, from other perspectives, maybe a little bit wacky.
I think, again, back to understanding the underlying cause, the physiology, be it the anatomical distortion, whatever that is. I feel giving people lifestyle ideas, whether it's what to eat, when to eat, how to eat, who to eat with, gives them power. And so one thing we try to do is empower people, help them understand the underlying issue, help them understand how you can control it. I may do, or Dr. West may do some prolo ozone therapy on them. We do some neurotherapy on them. That's a procedure that we're doing to hopefully assist your issue. But here's some things you can do to do that. And when people get that, in my experience, they go, oh, so I do have a little more control. And if you ask them, if you know what to ask, especially, like back to arthritis or joint pain, help them document, okay, every time you drink a Coke, how do your ankles feel? Or what if you eat a large pepperoni pizza? How do you feel the next morning? Get them to start seeing that what they're doing is affecting or influencing their pain. That gives them power. And I think once you empower someone, they're more apt to comply in other areas.
So let's maybe go down, because you started a list, and maybe Jason, you can add to the list of some of the tools that you utilize in your office fairly routinely. So prolotherapy, I think I heard. You talked about IV vitamin C. Ozone, I think. So give us a list of kind of some of the tools that you use.
Well, two things. One, the really important part of, you asked what the hardest part in dealing with patients that have pain, and my response to that is the dependency on the quick fix or the prescriptive medicine, and then helping people get off of it. I think that's one of the hardest things on my side of the fence that I come in, because so many times people come in and say, look, they're giving me Percocet, they're giving me Tramadol, they're giving me, Norco or something, and I don't like it, or I don't like it feel, or the doctor cut me off, and now what I'm going to do. And for me, the challenge is not so much the pain. The challenge is when we get people involved that are just saying, here, just take this and you're fine. Then going back to what would we do for us? So if someone came in and said, I'm in acute pain, or I want an alternative to my prescriptive med, it is balance, 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 because imbalanced people don't get sick and they don't get symptoms. So what is it? Is it a toxic relationship? Is it a toxic food? And then as we put, IV vitamin C has an amazing inflammatory response. We can do vitamin injection therapy.
When you say inflammatory, you mean anti-inflammatory?
Yeah, anti-inflammatory. Like it literally binds up with inflammatory markers. It turns on your immune system, and everybody thinks immune system has to do with getting sick. Well, if you sprain your ankle and it gets swollen, and then, and if you haven't had a chance to see our friend Dr. Bueller to get the muscle activation working, where he can turn it off quickly, what happens is the immune system comes in and it has to destroy the damaged tissue, it has to cart it away, and then it has to repair it. And that's all in the immune system. And IV vitamin C helps to really stimulate that. You've got acupuncture that's really good. And of course, being a chiropractor, adjusting therapy and getting everything lined up, amazing effects. Then you can hit them with the nutritional things, Boswellia, Arnica, and our favorite protocol, or at least my favorite protocol, essential fatty acids and proteolytic enzymes. If you get them into people at high enough dosages, it acts just like over the counter without ruining the liver, ruining the kidneys. There's so many neat ways to take care of pain where you don't have to go and kill yourself either with an opioid or one of those toxic over-the-counter medicines. People think they're safe just because you don't need a prescription. They're not safe.
And I think you're bringing up a really good point. Is a lot of times trying to solve one problem through medications, prescribed or over-the-counter, leads to now other health problems that didn't exist before.
Well, if it's not trauma, the next thing that I always look at is tell me what your meds you're on, because I got to figure out, am I treating a problem or am I just treating the side effects? And it's really funny because there's no such thing as side effects. There's effects.
Yeah.
Drug have effects.
Adverse effects.
Right. And people are like, well, it was accidental, so it didn't count, so we'll call it a side effect. No. That's clever marketing. Those things have effects, period. And then once you recognize, is it a disease, is it a trauma, whatever, or is it a drug? If it's not that, okay, let's roll up our sleeves and go to work.
So were you from the very beginning, as you're in the traditional medical model, did you always see this, or did you have an epiphany moment?
No, I think I always saw it just from my own experience growing up with bad asthma and tying in what I was eating with my breathing. And then getting out of it with learning how to eat better, exercising on a regular basis. So when I first went into medicine, my whole goal was to teach the whole world how to eat right and exercise. Learning the disease states was my goal, learning about pharmacology and passing on drugs. Maybe that was a side effect. But really my goal was, my gosh, I really fixed my own breathing problem by paying attention to what I was doing every day. I got to share this with the world. So it's a continual epiphany moment, how powerful lifestyle is and how powerful the hormones are and how much control we really do have over our wellness or our illness. So I get excited every day because I learned so much from this guy. I learned so much from working with patients. There's not a patient I haven't had that didn't teach me something. And that's one of my favorite things about being in practice is, wow, I learned so much today.
And Patrick, he's being really humble. When he said share it with the world, he's written 8 books. He just came out with a new book called Obtainable, how to get your body, obtain the physique that you want. And then what the other amazing thing that he does is he just soaks in everything and then be able to come back and actually teach people, hey, this is how you can get your health back. This is what you can do to recover. And it's so fascinating to me to be with a traditional trained medical doctor that gets it and says, okay, you are what you eat. You are what you absorb first. And then I don't want to, I was going to tell this, but he deserves it. Tell him about the hormones and the car analogy, because this is the best way I've ever heard anybody explain hormones to patients, is how he explains if your body's a car.
Sure. First of all, I think hormones get missed in chronic pain, if I may. One of my biggest referral sources for my hormone practice are pain doctors, because anybody on chronic opioid therapy turns off their hormone system, their sex hormones, the thyroid goes wacky, turns it off. So one of my biggest referral sources for purely hormone management is from pain doctors. The issue with hormones is, one, they get a bad name because of assumed cancer reasons. We won't go into detail there, but the common thought is, well, you naturally run out of hormones as you age. Women go through menopause, men go through andropause, or whatever you want to call it, and that's a natural occurrence. Well, my argument is, well, your car runs out of oil. Do you change it? That's a natural occurrence.
Right.
And of course we change it. And you can't really argue against that. I think maintaining hormonal health is essential for pain control, for overall health. It really changes the quality of life. It changes, I'm convinced, though not many studies behind this, it changes longevity as well. But again, back to the chronic pain issue or any pain issues, getting someone's hormones balanced, incredible intervention for pain.
Yeah, and what's interesting is that most people would separate those two areas.
Totally.
Right, and that's, like you said, the problem with boxes that are all separated as compared to putting them together, and that not many people are talking about the relationship between pain management, and also hormones. You know, they'd say, oh, you have a hormone problem, you have a pain problem. But I think in the end, what do we understand? Pain is not the problem. Pain is telling you there's a problem, which is a different perspective.
Yes, sir.
Warren, you said something very poignant that I don't hear many doctors say, or I don't think I hear any doctors say, and you just said it, and it's really fascinating to me. And it was that I seek to learn from every patient. That's got to be a real journey into what it means to be humble, what it means to be awed by the body every single day and this creation. And it also shows an ambition to say there's something more for me to know and understand. It means I get better every day because I get to have this relationship with these patients. And I have to imagine that somehow that perspective and the dynamic of what you're talking about in the culture of the West Clinic that you obviously are focused on creating is a big part of what generates healing amongst the people. And that's that X factor, that's that intangible, I guess, that is not just this mechanized box that we try to put people in this mechanized algorithm of a protocol for intervention, but saying there's a spirit around all this. And if you allow yourself, you can really be awed every single day as you show up.
Oh, absolutely.
So, just in 10 or 20 seconds each, any summary thoughts before we tie up?
I think that's part of the most powerful part of medicine is the art of medicine. And Dr. West and I have joked that between the two of us, tens of thousands of patients in how many years, even though I am older, he is wiser. But the cool thing is, I tell people this all the time, I'm going to treat you, but I've never treated you. So what am I going to do? I don't know. I may have written tens of thousands of diets. I've never written one for you. Mm-hmm. So I'm going to learn from you what we need to do. And then as a team, all of us, we're going to progress towards optimal health, optimal living, quality of life. That's really what's important. I think the good Lord gave us all a certain amount of time here. What we do at that time, that's up to us.
Yeah. And I would say to that, if people are chronic pain or watching or looking at this, is there's always hope. There's always, never give up, never keep fighting. We have so many people that walk in and they're like, I just don't know where I'm supposed to go. I've been to 11 doctors, I've been to 7 doctors, I've been to 13 doctors, and this is what they've done. And we start going through, and we're just, one of the first things we ask in our intake, like, what have you tried so that we don't repeat creating the wheel? Because if it would have worked, you wouldn't be here. And then bringing something to the table, and then people will say, well, I tried a version of that, or I tried a version of that. Man, keep fighting, keep looking for things. And when you find the right doctor and the right treatment interventions, medical miracles are still possible.
That's terrific. Well, I really appreciate both of you spending your time and sharing your experience, your wisdom, and your fun. You certainly seem to have a levity around all of this, which I think is unusual in these realms. So thank you for bringing that all here and sharing it with us.
Yeah, thank you for the opportunity.
Thanks for having us.
What a dynamic duo, huh? Amazing the type of work that these people are doing, looking at people with different professional credentials getting together, collaborating, and really helping people. It's really encouraging for me to watch, and I hope it was for you too. I get a lot of questions on CBD, and many people see it as a great panacea for people struggling with varying conditions, including pain. Melissa Gallagher clarifies a lot of this, and I walked away from this interview with a much deeper understanding of the applications of CBD and what the possibilities are. Melissa, thanks so much for taking some time to talk to us.
Oh, thank you. I'm excited.
So tell us about your background. How'd you get into the type of work that you're doing?
Sure. So it all kind of came about from my own health life crisis, or life crisis. That was a health crisis, that kind of combination. Essentially, in my early 20s, I came down with a really acute case of Epstein-Barr virus, and it really wiped me out. And it took me a little bit of time, and I think the biggest challenge that I had as an individual who was feeling run down and exhausted, and I was in a corporate job that had me traveling a lot, I went to my normal physician, and he felt my lymph nodes and said, I think you have Epstein-Barr based on my condition. And then I said, okay, great. Well, what do I do? Is there a pill for this? And he said, no, you just have to kind of wait it out, rest, and take some vitamin C. And I remember thinking, there's got to be something better than this. And I didn't know anything at all about natural health and wellness or acupuncture or any of the kind of natural modalities. But I started to explore my own healing in that world. And so I actually ended up having an amazing blessing of meeting with and working with a doctor of Chinese medicine who became my mentor and basically encouraged me to pursue this as a profession. And I remember the second time I was in her office, it was just so different. I literally came from a corporate setting and would go there at lunch, and it would be this really peaceful Zen experience, and she had water flowing, and I just remember thinking, oh my gosh, I want to do this. What am I doing in this corporate rat race? So I said out loud, I think at some point, I want to do what you do, but I don't do needles, and I don't really like the kind of invasive stuff. And she said, well, you're going to have to go back to school. Yeah. And that's what I did. So I used the master's program that I enrolled myself in to teach myself about nutrition and how to use food as medicine. And then from there, I ended up being able to work and pursue a doctorate in naturopathic medicine. And the rest is kind of history. I literally have healed my body multiple times as, things kind of get imbalanced. And it just changed my whole entire perspective of the way we deal with illness and disease, and how to treat the body more holistically is ultimately my focus in my professional life.
Were you fortunate to kind of figure out it was Epstein-Barr in the very beginning? A lot of people kind of are undiagnosed for a long period of time and are enthusiastically going in the wrong directions.
Yeah. So my case was, it took about 3 months for me to kind of wipe away the denial that something was seriously wrong. I did everything wrong in terms of how I was trying to fix myself. So, I'd work, and instead of a cup of coffee, I'd be drinking several cups of coffee. And then when the coffee bar closed at like 2 or 3, then I'd switch to hot chocolate. And so I was caffeine and sugar, and then I'd go home and run.
Is that 2 of the 3 basic food groups? Caffeine, sugar, and fat?
Essential to corporate lifestyle, right? Yeah. So that, I think that it lasted for several weeks, and ultimately I was falling asleep at my desk, and I had a colleague who tapped me on my shoulder and said, Melissa, something's wrong. And the doctor they provided, the name of the physician I saw, he was a more open-minded physician, but even still, he was very much limited with the treatment protocol for me. And I think that that's a big challenge that I see with a lot of my patients is Epstein-Barr. And it is a pervasive type of virus, and it can flare. And I honestly have battled it multiple times in just trying to keep my body healthy, and stress and diet and, environmental changes all factor into my own management of it. And so, yes, I was lucky that it was so acute that it did cause me to get help sooner. But I think the challenge is in my 20s, I had never felt really ill.
Yeah.
But I work with folks, men and women in their 30s and 40s, that it's not as acute as my case. And so it's this chronic state, chronic condition where it's challenging for them to even recognize. It might be hormonal, it might be a thyroid dysfunction, it might be something else going on. And I definitely was very lucky in that I had a doctor who recognized it, and we tested immediately.
So what are your activities now? I know that you're seeing patients, obviously, from what you just said, but you're doing other stuff too. What is it?
I am. So I still see patients in person, and I have gone more into the virtual world of working with my patients. So now I actually work with folks all over the world.
Cool.
And part of a recent move that my family made to Atlanta, Georgia, from Tampa, St. Pete, I started to cultivate a YouTube channel I had. And so that has kind of grown exponentially in amazing ways.
What kind of content do you put on it?
Yeah, so all of it, so the channel title, it's called Natural Health Resources, and it's really all natural health resources.
Wow.
Resources that...
No mystery there.
No, right, yeah, so pretty nondescript. So essentially the goal is to create a clearinghouse, a database, if you will, a library, a video library of different health and wellness related challenges, issues, ailments that people might be searching for or have questions that they're seeking answers, like I had been. There's a big difference between the early 2000s and now in terms of what we have access to online. And so that's a big focus that I have professionally. And then I also teach. I teach for different companies. I educate patients, and I also educate providers for either equipment or products that they're providing, and educate them about the conditions that their services and products and equipment, the utility of the equipment, and really bridge that gap between the provider of service product and the patient level, because I see both sides.
Yeah. Do you deal with many patients in acute or chronic pain?
Absolutely, all the time.
Yeah.
All the time.
So what is that like, and how has that changed maybe since you started practicing till today, as far as what kind of technology or things that you use?
Yeah, so it's changed a lot in terms of the social awareness is much greater. So that's a big factor. I think the community at large is more tuned into the pain. We have a pain crisis.
Right.
I mean, we have an opioid crisis, but we have a pain crisis. And the pain crisis is not just a management crisis, but it is a global condition that has been manufactured or developed over decades of time with some individuals. So technology has allowed us to do better testing. So we can do lab testing, we can do genetic testing. That's a real big factor. Some folks are more genetically predisposed to feeling pain or having pain-related conditions. Then also there are greater resources in terms of complementary therapies. Acupuncture is a great example of that. That's what I had been exposed to with Epstein-Barr. But then we also are now starting to see CBD into the world, and we're seeing greater resources and accessibility to manage the pain crisis. And for instance, I have a patient that I'm working with right now. She has multiple conditions. She has lupus. She has rheumatoid arthritis. She has a secondary condition also from the lupus called Sjogren's disease. And it's a condition of the mucous membrane. And it basically dries up the mucous membrane. It's an autoimmune condition. Those assorted autoimmune conditions individually, but then collectively, just create this entire pain body. And her previous pain management methodology that had been used was opioids and steroids. And those have a shorter term type of purpose and utility, but over 10, 12 years, they start to impact other systems and glandular activity in her body. And we're starting to see with her management, she's being forced out of the narcotic use and the opioids. That's a big challenge where her condition hasn't gone away. It's progressed by way of acceleration of the disease, and then also utilization of some of these medications, contraindications as well with the medications. So I'm working with her in reducing the pain body experience and lowering inflammation through an assortment of things.
And those two things are related, I would imagine, many times.
Yes, hugely related. Where there's inflammation, there will be pain. And what most folks don't realize is inflammation is a condition or a situation in the body where there's an accumulation of fluid. So we actually have an enlargement of cellular activity, or the cell tissue itself enlarges. We'll have fluid that impacts the lymphatic system and the subcutaneous fluid and the layers just underneath the skin level in between the muscle, fat cells, and the nerves. That then becomes inflamed and enlarged or accumulates with fluid. That then triggers some of the nerve response. And so if we can minimize inflammation, which as a naturopath, we believe that inflammation is the root of all disease. So inflammation globally in the body is...
Is it the cause of the disease, or is it just coincident because there is disease?
It's chicken or the egg, right? In many cases, it starts out primarily as the precursory condition. And I say this meaning, for instance, I personally and professionally recommend thermography, which is a really wonderful way of thermal imaging your body to assess inflammation in the body. We can assess cellular changes, even cancer cell changes, early on. We can be predictive in some of those cellular changes based on inflammation. So inflammation will tell us a lot about what's going on. But what sets up inflammation is diet, lifestyle, stress, things that are supposedly easily managed, but there are things that might not be able to be managed. Environmental factors, not everybody can just check out and go on a vacation to support their adrenal glands for 6 months.
Yeah, so when people have pain, in this one case you're talking about is very chronic in nature, I guess there's two things, right? It's trying to provide some comfort, now because there's pain, but I guess also the cause of the pain has to be considered so that you're figuring out not just how to manage pain, because pain management clinics, many times it's managing just the symptom. And as you described, there's collateral effects of all that, right?
Absolutely.
As far as saying, hey, you're creating other problems by taking these noxious medications.
Sure.
But then you also are looking at how do you solve the problem. So you mentioned CBD. Is that just a targeted pain treatment, or does it have also healing parameters that are part of its dynamic.
Sure, it does. And what's great about CBD as a naturopath, our focus as naturopaths is to address the root cause of illness and disease. So when we start to look at those causative factors like environmental stress, emotional stress, we'll see chemical stress, inflammatory related stress. I think the inflammatory related stress is a big factor for some of these chronic pain conditions. CBD can help us drill down into the different layers involved. So if there is a central nervous system aggravation, we can use CBD to lower the central nervous system and balance that out. We'll also see on the emotional side with depression, anxiety, panic attacks, and even PTSD, we'll see the limbic system be balanced out by that. And my practice originally was in St. Pete and Tampa. MacDill Air Force Base was within 3 to 4 miles of my location. We had a ton of patients in my clinic setting that were returning individuals, soldiers, and even veterans that were dealing with traumatic stress from their exposure to the wars that we're dealing with. And we're still in that situation. And we've seen the rise of PTSD and the rise of suicide rates. I do believe that CBD can be a really great resource in managing that emotional side of pain to help individuals better balance themselves and feel more like themselves and less detached emotionally.
So are you seeing that it is effective in acute and chronic situations?
Yes.
And how long have you been utilizing CBD?
So I have been, and this is really kind of a unique setting because we've had major changes in the last year, 2 years, where we have much greater accessibility, and individuals and patients are able to consume CBD statewide legally for many. I've been working in the space of CBD and even cannabis, medical marijuana and cannabis for over 7 years now. And in my practice in St. Petersburg, I was not the individual dispensing that, dosing or anything like that. But what I was working with were patients that were cancer patients seeking alternative treatments that literally I had one patient, she was growing her own marijuana. I mean, she wasn't growing marijuana, but she was growing the cannabis plant.
Right.
And the purpose of her growth was not to be, a drug dealer or even to use the bud. She was strictly focused on extracting cannabidiol, which is one of the multiple resources that cannabis plant offers as an inflammatory agent. She would juice the leaves. And it was really interesting because she had different types of seeds that she was growing. I mean, she kind of had a grow house in her house, but she was using it to combat a stage 3 breast cancer diagnosis. And I was treating her lymphatically, and we were doing a lot of work with some of the other factors, stress management and dealing with the adrenal system. In a period of, it was 18 or 19 months, she literally had a reduction in the tumor size. And what had been a stage 3 tumor mass ended up just registering as a calcification.
Wow.
And she was strictly juicing the leaves of her cannabis plants.
So this begs the important question, the CBD world, cannabis, it's very confusing as far as saying, are all products the same? Are they different? And so if I'm a consumer that says, okay, I'm struggling with varying conditions and pain, I want to invite this into my life and look for an opportunity to help solve my problems through it, but I've got all this conflicting stuff. I get all this marketing information. I don't know how to sort it out. How would you help somebody like me?
Sure. So essentially, we would sit down and I'd first want to assess what all is going on with you, addressing what the root cause of whatever might be causing you grief or pain or anxiety or whatever it would be. From there, I would look at recommending, in some cases, we might recommend a topical CBD cream or serum. And there's just been a huge growth of a lot of different resources now. So, you know, the patient I had referenced before, you know, we're not juicing that yet. I would imagine we probably will. We'll probably see, if you've ever been to India, you know, they have lassis, you know, the bang lassis, where you can have, you know, the hemp leaves and extract in it. We might be seeing that in the future. But essentially what I recommend for all of my patients is to be conscious consumers. I think that's the most important part when it comes to consuming any type of product. We have to be diligent individually and to not necessarily trust the labeling or even our government guidelines or, you know, pseudo guidelines and stamps of approvals that may or may not have any meaning behind them. So conscious consumerism is crucial in terms of identifying products and brands that are going to deliver the right type of product that they're enlisting on a bottle. In the CBD world, there are brands that I think are just trying to go with the trend. And we're seeing, unfortunately, I'm seeing patients that are getting drug tested and they're actually failing their drug tests. And these are, you know, everyday individuals that might work for the Postal Service or military members.
Because they're taking CBD.
Because they're taking CBD.
So what would I look for now? So like you're saying, you know, labeling, maybe you can't even trust the labeling, but what are some of the things that I'd say, okay, here's what I'm looking for. Is it longevity of a company? How long it's been in business? Is it lab work that they put on their website? Yeah, what am I looking for?
The big part is sometimes it's not so much longevity now, but essentially the CBD that you want to consume, it is full spectrum, and full spectrum means that they're using all the parts of the cannabis plant, meaning the leaves, and often...
Is that because there's synergy between these parts?
There is synergy between those parts, and the little leaves that are closest to the bud or the flower, the leaves that are closest will have the greater concentration of cannabidiol. And we will see a lot of times brands labeling that as aerial parts. And that means that it's the closest to the bud, it has the greatest potency.
Okay.
So potency is one factor. So full spectrum, I like to recommend assessing the harvesting process. There are a lot of brands that are using CBD that's being imported. There are trace elements of THC in some of the products. There's even still, with our guidelines, we can see a certain amount of THC and that's acceptable, but anything above that is deemed not acceptable. So that means that we need to make sure that brands are using third-party lab testing. So that's a real big factor. I'll have patients and folks that watch my YouTube channel that'll comment, I'm using X, Y, and Z product, and I don't know how much, I don't know what the dosage is. So there's a lot of confusion even on the bottle. So for instance, if we had an oil, if the bottle says, let's say 1,000 milligrams, it's not a dose that's 1,000 milligrams, it's the bottle itself.
Very much like fish oil.
Yes, very much like fish oil, exactly. So in the fish oil world, all of that's perfectly labeled.
Right.
In the CBD world, it's kind of a free-for-all. Right. It's a wild west, if you will, in terms of what brands are choosing to label, and then how descriptive are they being about the milligram dosage per dropper or capsule or gummy or whatever they're consuming.
So you're looking for dosages compared to amount of oil.
Yes. Yeah. Yes. Yeah. I believe that we're in a state right now in the CBD world. I equate it to where we were with vitamin D 12 years ago. And when I first started my business, I had a large retail center as well. And I remember trying to buy vitamin D that was higher potency because I was recommending higher potency. Then the max potency was 800 IUs of vitamin D. Now I can recommend and script one of my patients 50,000 IUs in a little capsule. That's come a far way because of a lot of research and a lot of clinical data that showcases the benefits of using vitamin D and helping balance our immune system, and support anxiety and depression and just globally support ourselves. I think we're on the same precipice or on the forefront of that with CBD, that the milligram dosing per serving size is the most important thing for us to look at, on top of where has it been processed, the manufacturing process, making sure it's clean product, free of pesticides and herbicides, and even the lab testing, that there's QC on every batch that's coming out.
Is there a recommended dosage now that you think is kind of like a sweet spot? Or, so now I'm going and I'm reading, I'm saying, okay, I got to look for the dosage in the dropper. What dosage am I looking for?
So I actually have created a quiz, an endocannabinoid quiz, to help my patients, help myself figure out the right dosing. And I have that accessible online, and I often recommend on a lot of my video content communication for folks to download that free quiz to check out. The quiz is a good guide because a lot of symptoms that people don't even think about, like insomnia, or maybe they've had a seizure before, or they have intense headaches, and an collective assortment of symptoms will generally tell us a little bit more about your endocannabinoid system. So this is where we can get very specific and individualized with the treatment plans that I have with my patients, where I want to assess ultimately what's going on in your endocannabinoid system.
And explain endocannabinoids so people understand.
So this is really exciting. The medical community actually is now recognizing this. So in 2004, they've identified we have a body system called the endocannabinoid system, like our endocrine system and our cardiovascular system. So that endocannabinoid system, essentially, it pairs up really well with cannabidiol, or the hemp plant, and all of the benefits of the extracts and terpenes. That system is highly receptive to cannabidiol. And when we don't have cannabidiol in our daily diet or in our daily use, we end up being in a deficiency state. So I look at the endocannabinoid system in your body just like I would if you were dealing with adrenal fatigue or adrenal dysfunction or thyroid or hormonal imbalances. That endocannabinoid system, this is kind of, I'm going to say this is a little bit not so cutting edge, but I think it's going to be a system that at this point right now, there's no testing.
Right.
We haven't had that developed. I will predict that probably will come about. There will be some better ways for us to test that as we assess. But we do know that we have receptivity, cannabidiol receptors, and the receptors in the body that when we consume, either topically or orally, consuming digestively, cannabidiol or CBD, those receptors are invigorated. And that's where we see a lot of the balance with pain, hormones, inflammation, depression lifts, anxiety dissipates. So the receptivity of our body, we're perfectly matched up, and we are in unison with the benefits of the cannabis plant.
Would it be okay for our viewers to take that quiz that you discussed?
Oh, sure. Absolutely.
Yeah. So, all right. So we'll make sure that we put a note in there so everybody can have access to that. So
Absolutely.
Thank you for putting that out there.
I'm happy to. I just, for the viewers that do take it, I just want to give them a little word of caution, not to be alarmed if you are in a severely deficient state. It's very common for us to have some degree of deficiency because we're not consuming cannabidiol.
Yeah, and especially I'd imagine if you're having some kind of a chronic condition, it might even deplete it more.
Absolutely.
Yeah. So where do you think this is going now? So obviously CBD, you're a big fan. You're seeing multiple aspects of benefit, not just. It's not like just an aspirin. Hey, you got pain, take this pill. Right. But literally, it's working in the body, and there's receptors in the body for it, and somehow it's balancing nervous system, reducing inflammation, doing all these things. Is there anybody who shouldn't be utilizing it? Are there people who are contraindicated?
Yeah. So, and this is again the challenge that we have here in the States is that it's just. So we're in this weird state. We're in this weird kind of limbo. We've had the Farm Bill passed recently, and that's helped for a lot of manufacturers and companies that are putting out great products. And it's great for consumers and patients. The challenge is it's still federally illegal. And because of that, there's this weird kind of battle going on between the CDC and the FDA. And we see recently the FDA has had their first hearing, and some of their communication about CBD in food-based products. So the challenge we have in that weird bubble is we are not necessarily digging into the clinical research and clinical data we really should be seeing to dig into the contraindicators. So I always kind of side with a lot of the European publications, but contraindicators generally would be, I would not recommend it for women who are pregnant and breastfeeding mothers. Not that it would cause any grief, but we don't have any data that it doesn't.
Right.
And so I am a mother, I have a toddler, and we breastfed. So I was pregnant, we breastfed, and during that time I didn't consume any CBD. And that was just because I don't have anything saying that it wouldn't be bad. Now with my toddler, I do use topical CBD balm on him, and I'll put a little balm on his feet at nights, mixed with lavender and some other really nice kind of essential oils. And
For sleep?
For sleep,
yeah.
yes. I unfortunately have a toddler who does not sleep. But at some point down the road, when there's a really great clean gummy, I will be having that be a part of his daily dosing of supplements.
So it's interesting, and now we're seeing the integration, saying essential oils, lavender, the CBD, and these are natural substances that can be absorbed through the skin. Is what the way that you're doing that.
Yes.
Wow, and that reduces your pain by proxy.
Yes, absolutely. Yes.
Your kid sleeps and no.
My sleep is balanced, and I don't even need CBD in my own body. It's all it is. Yeah, it's a great adjunct for a lot of people, and in fact, I work with professional athletes, and there's a fine line too with the drug testing that they're being required, and there's a lot of use with the topicals. Because of the integration into the bloodstream, it's 26 seconds when you put a topical on your skin that it gets integrated into your bloodstream. And so we can actually use topical creams on a carotid artery to instantly get nourishment, cannabidiol, break through the blood-brain barrier.
Wow.
And balance the body.
That's been demonstrated. They
It
measured
has.
that, huh?
Yep.
So, it kind of begs the question, what else are you putting on your skin that's getting absorbed,
Yeah,
right?
yes.
Whole other subject.
That
Not
is-
the purview of this this interview.
Yes,
but,
yes. I talk a lot about green, clean, and toxic free. But and that's going back to ingredients in CBD oils and products. We want to make sure that, as with any type of supplement, that there are good, clean additional ingredients, because you just don't get a CBD in a capsule or in the actual oil. There's a delivery method or a delivery mechanism. So we're seeing more of like the coconut oils, and sometimes it'll be hemp oils. And that leads to a lot of questions that people have. Like, I get all the time asked, what's the difference between hemp oil and hemp oil or hemp seed oil and hemp extract oil? Well, one is just an extracted oil without any CBD, and because it's a different part of the plant that's being processed, and the hemp extract has the CBD in it. So this is an active ingredient with the CBD.
So you want hemp extract oil.
Yes.
Not, and what was the other one that you don't want?
Hemp oil.
Hemp oil.
Yes.
So even if it says like full spectrum hemp oil, it's still not necessarily the extract.
Well, that's where you have to kind of read your labels, and you have to dig in. And I actually recommend folks to go to the manufacturer's websites. They all have customer service lines, or should, if they're reputable.
Right.
They have some 800 number, some resource for you to dig in to read, because they're brands that will have a hemp extract oil, or they'll label it cannabidiol, and they'll have the delivery method, the actual oil that the hemp extract oil is in, it's hemp oil. or coconut oil. So you'll see a lot of different kind of variations. But when you go to your supermarket and you buy hemp oil that you might, kind of use in salad dressings or, kind of dress your eggs with, that's not CBD oil.
You're not getting CBD in it.
Yeah.
So what is the difference then if something's labeled CBD oil or hemp oil? Hemp extract oil?
Yes. In some cases, there is no difference. It just depends on the manufacturer's methodology or marketing of that product. I think there are older brands that have been on the market before the Farm Bill and have not changed the labeling where it was hemp oil, because that's kind of how you had to communicate your product.
Right.
Now we have greater flexibility with that term CBD. But CBD and hemp oil sometimes are the same and sometimes they're not.
What a confusing world.
It's very confusing. It's so confusing. And the challenge is, for a lot of the folks that are dealing with these conditions, they're already feeling fatigued and run down, and the brain fog that they're dealing with, or even just the mental capacity to figure it out. It's really challenging.
And one thing to understand though too is that if you feel like you've tried this and it didn't work for you, maybe you didn't try the right thing, because sometimes they're throwing out the baby with the bathwater, saying, I did that, it had no effect, I'm moving on, as compared to saying, you took something that really wasn't the right thing, and now try this, and maybe it will work for you.
Absolutely. I actually had an instance recently where on one of my YouTube videos, somebody commented, I've tried 750 milligrams of CBD or hemp oil, and it didn't work. And my first communication is, well, okay, hold on. Was it the bottle dosing? Because 750 milligram bottle dosing, a serving size might get you anywhere from 11 to 13 milligrams. That's not a whole lot.
What is the range, like the low and the high range, would you say, in dosing?
So right now we're seeing anywhere from 1 to 3 milligrams per serving size. So that would be what you might drop on your tongue or take in a capsule. And then we're seeing now the most I've been able to find is 150 milligrams in a single serving size.
And do you want to go that high? 150 is a good, so more is better for the most part?
Depends on the case, but I'll give an example. Okay. For a chronically inflamed individual that is dealing with intense pain or a severe hormonal imbalance, in this category, I put my infertility patients in this bucket as well, and then my menopausal and andropausal patients in the same bucket. I don't want to say more is better because every case is different.
Sure.
But what I find is that individuals that are so deficient find that more is better.
So they can take multiple doses if it's a less amount.
Yes.
Try to get it up there.
Yeah. In a flaring state like a lupus flare, I'll have folks dosing 2 or 3 times a day until the flare subsides. And what they're starting to see, and this is just all kind of my clinical, data that I'm gathering with my patients. What they're finding is the flares are shorter. And I'm even starting to introduce this both topically and then internally with my patients that have shingles, which is, shingles is we're not talking about it, but a lot of folks are dealing with shingles of all ages. Yeah. And when an individual has a shingles outbreak or eruption on their skin, it's extremely painful. Yeah. And the nerve pain is really intense. You'll have the nerve pain before you have some of the blistering. And sometimes folks don't even have the blistering. Wow. They just have this really intense nerve pain. So much pain that when their shirt touches their skin, it's excruciating.
Wow.
So, and those folks, we can do the topical application of a CBD serum or cream and then orally take that. And I mean, it is better than any pain medication that they are prescribed for the shingles, which often they're not prescribed.
And that would be anything. An acute thing, yeah.
That would be acute. So, and I think I'm encouraged by the different physicians and providers that are starting to get into assessing in their own clinical world. I think that's right now. I think we have little clinical bubbles of just figuring out where dosing benefits different types of patient profiles. I think over the long haul, as we see different changes, I think ultimately the patients and the consumers are going to drive some of the legislative changes. And when a patient comes to a doctor, traditional general practitioner, and they say, I'm using CBD, that doctor now is forced to, in many ways, figure out, okay, well, what does this mean?
Right.
And how do I utilize, or how do I work with this person to help them and manage their care, but they're also using CBD. So I think patients and consumers are driving more awareness in the medical world.
Yeah.
And I do work with a lot of, I have a lot of synchronicity with different providers where I'll work with cancer doctors, assortment of oncologists, and even surgeons. And post-surgically, that's a big area of my focus. Post-surgically, CBD is great for that.
Yeah.
And the post-surgical cases, whether it's elective surgery or there's a hip knee replacement surgery, the doctors are on board with whatever way to minimize both inflammation and pain, and also minimize their scripting of some of the opioids.
Yeah. Well, this seems like a weird and wacky, but potentially very beneficial world for humanity, and a lot to navigate. But I certainly appreciate you taking the time to share your experience and expertise around all this, because I know there's a lot of people searching, and I think there's probably some great solutions here for them.
Absolutely. I hope so. And I would just encourage any of the viewers who see this not to give up, and to not doubt their body. Our bodies come equipped with self-healing capacity. And sometimes we just have to tap into the right resources to allow the body to heal and balance itself.
Very wise words. So thank you very much for spending this time.
Thank you.
For a while, I've been excited about CBD and the possibilities it has brought to humanity, but after my interview with Melissa Gallagher, I have now amplified that excitement for CBD. My interview with Tim Sciat was very revealing, no pun intended with Revealed Films, but he talks about CBD. He's got a lot of experience and a great background in nutrition in general, but the application of CBD and understanding the nuances and the differences between different type of CBD products is very critical, and he cleared all that up for me, so enjoy this interview. So Tim, thanks for taking the time. I'm looking forward to clearing up some confusion around this issue on this conversation.
Yeah, I'm excited about this one too, Patrick. Thanks for having me.
Of course. So let's talk about your background briefly. How did you get involved in the type of work you're doing?
I got interested in supplements back when I was in high school and college, and I just realized the power that they had. I was an avid athlete, exerciser, and just really saw the potential that nutrition had, and then how supplements kind of the icing on the cake in many instances to really help accelerate fitness, not just for me, but for the clients that I worked with, which I've been working client-facing for 20 years now, general population and athletes, all different levels, all different ages. And so supplements play an integral role in each person's health goals and concerns, and the level of that role differs depending on where a person is. High-level athletes who have everything dialed in, supplements maybe a little bit more. Someone who's got a very, very poor lifestyle and has a lot of room to improve in lifestyle factors, maybe supplements don't carry as much weight, but they can often be the low-hanging fruit to get you moving down the right path. So it's individual, but I think that there's some application of supplements for pretty much everyone.
So in this particular instance, we're talking about people who are challenged with pain, acute or chronic pain, and looking for solutions. And a lot of times they're looking for a non-pharmacological solution. They're looking for things that are more natural, won't hurt them, maybe even help them beyond their pain. And you have been involved in development of CBD products.
Yeah, I've been really, really interested in CBD. I mean, you can't go anywhere without seeing the CBD dispensaries or seeing it online. It's very, very popular right now, and for good reason. I think that there's a lot of promising research out there. I think there's a lot more research that needs to be done, but I think what's out there right now, I would say the evidence, because both the scientific evidence and the real-world evidence shows considerable promise. And in the context of pain, There was a recent study that basically polled a few thousand individuals, and the idea was to try to find out why are people using CBD. And one of the top 3 reasons is for pain management. The other top 3 would be stress management and for sleep, as a sleep aid or something like that. And like in that context, what you talked about too, Patrick, is like looking for non-pharmacological options. It's really encouraging to me because when you start to look at like opioid statistics, sleep med statistics, alcohol abuse statistics, it's concerning, and they're going up. And so if there is an alternative to those things, that would be fantastic. And CBD does seem to hold promise with that. And there's even some research that shows that CBD supplementation may help folks who are addicted to opioids get through cravings and get through stress response to that, because part of the challenge that people face with an opioid addiction is it's an addiction, first of all, but the symptoms associated with that addiction, those anxiety-like behaviors, those cravings and things like that. So one of the more promising ways that I see CBD helping is alleviating the constellation of symptoms associated with a variety of chronic diseases. So I think I'd put it out there that CBD is not going to cure or treat a whole lot of medical conditions per se, but the symptoms, the consequences of those conditions, CBD does seem to be quite helpful with.
Now, it seems like there's a gold rush to CBD. You know, everybody's jumping into this industry. So maybe we could do a quick rundown on the good, the bad, and the ugly. So maybe we'll start with the good.
Yeah. Well, when you said the gold rush, it also reminded me of that phrase that the wild, wild west. And that's a phrase that researchers have used, scientists have used in response to the CBD gold rush, is that it really is the wild, wild west. Everybody and their brother wants to be a part of it.
Right.
And we have some pretty alarming but pretty insightful studies that tell us that there's a lot of people doing it wrong. And so there was a study just recently published within the last year or so in the Journal of the American Medical Association, JAMA, which is a prestigious medical journal, that tested 84 different CBD products, and 70% of those did not meet the label claim, meaning that,
wow,
yeah, 70%.
70% didn't meet their label claim.
Yeah. And another alarming fact about that was that a pretty substantial portion, I think it was 30%, had higher than claimed THC content. Now, that's not to dismiss THC as having some value, but it also has psychoactive and addictive properties. And if you're buying a CBD product, you're going into it knowing, or with the assumption that this is either no THC or extremely low THC. So you're getting something that you're not expecting.
What should the upper limit of THC be?
Well, in any of these industrial hemp-derived CBD products, which if you're buying a legal CBD supplement, that's what it should be. The upper limit should be 0.3%. And that's a great segue into what you were asking about. What are people doing right? Is that now moving forward, CBD products from companies that are doing things the right way. There's really a couple of ways that you can easily validate their purity, potency, and safety. And one is that most of the bottles moving forward should have a QR code that you can scan, which should directly link the consumer to a page on their website, which allows you to search through the lot numbers of the product and say, okay, my lot number is 123. I'm going to click on 123 on the website, and I'm going to see that it contains this much CBD. That's what it says on the label, or plus or minus a certain amount. It contains this much THC or none. It looks at the microbiological. It looks at pesticides, herbicides, all kinds of things like that, because you want to see if it's testing out for those other things that you don't want in the product as well. So not just the CBD and not just the THC, but those other things. For instance, the hemp plant itself is a bioaccumulator or a phytoremediator, which is great for the ground, great for the earth, because it's drawing up the heavy metals and these toxicants from the ground, but it's in the plant.
Wow. And
so you want to test the plant to make sure that there's none of that remaining in there. Again, you don't want to put something in, you don't want to unknowingly put something in your body that's harmful here all this time you think you're doing something good for yourself.
Well, I've not heard anybody say that the hemp plant is a soil detoxification plant. So so now if you're growing the stuff in, for lack of a better term, toxic soil,
Right.
That's a bad thing.
Yeah, it's very concerning. And so that's why when you go to look for, another thing you can look for, in addition to the QR code, is the U.S. Hemp Authority has a third-party certification program, and that's an extra step that the manufacturer has to take to show that they are following the most stringent guidelines. So you can go to the website, the U.S. Hemp Authority, and see who's registered. It's not to say that everyone who's doing it right is registered, but that's a good way to narrow down the list. Right now, June 2019, there's 17 different manufacturers of hemp-derived CBD products that are on that list. And so if you go search for CBD, you're probably going to get 17,000 results. So if you want to narrow that search result down very quickly, just go to that website and find it. So yeah, those are some things that I think are interesting. And it brings me to another point, is that there are manufacturers that are vertically integrated. So basically, they control the whole process from seed to sale. And that's another way. Anytime you limit the degrees of freedom or the number of the hands involved, that's another way that you can ensure consistency, purity, potency, and safety. So to me, that's something else that you might look for, is that vertical integration, where they have control over the farming practices, they have control over the extraction practices, the bottling, and all that kind of stuff.
When you hear about the different sources of CBD, so is there other plants that should be extracted from or can be other than hemp, or should it all be from hemp?
That's a great question. Right, hemp-derived CBD would be the only one, and I think it's important to make the distinguishment that it should come from companies or industrial hemp. Meaning that the Farm Bill of 2018, which legalized industrial hemp-derived CBD products, companies that are producing this have to be certified through the Farm Bill. So they have to be doing it the right way. Now you have, again, part of this gold rush is you have people that are potentially growing hemp in their backyard. It's a bit of an oversimplification, but there are people that are not doing things the right way. But as far as where you're getting CBD from, the hemp plant would be the primary plant where you're going to get it from. It's up to 40. Hemp is up to 40% CBD, and it has a maximum by legal definition of 0.3% THC. Now, having said that, even though THC and CBD get all the love, there's a lot more to the hemp plant than just those two compounds. CBD and THC are known as phytocannabinoids, and we can get into that a little bit more. But the hemp plant has over 100 of these phytocannabinoids, and we're really just starting to learn about CBD. Even though, interestingly, CBD was isolated before THC in 1940s, but it was kind of put on the back burner when they started to see that THC was having the psychoactive effects. But be that as it may, so you have over 100 different phytocannabinoids in the hemp plant, and we're just starting to kind of break the ice on what some of these other ones do. Some of the other ones that are kind of up and coming are CBC, CBN, CBG, and we'll probably learn more about those. But in addition to the phytocannabinoids, you have compounds called terpenes, which may also have anti-inflammatory, antioxidant types effects. For instance, beta-caryophyllene is one of the most prevalent terpenes in the hemp plant, and is also in these full spectrum CBD products, and it directly binds to a receptor in the body that has an analgesic or pain relief effect. So, from my standpoint, if I'm looking for a CBD product that is going to help with pain relief, I'm probably going to be looking at a full spectrum product to get all the benefits, the synergistic, the entourage benefits of a CBD product as opposed to an isolate. Now, the instance where a CBD isolate might be a bit more of a better choice would be a topical, whereas you can apply CBD. The CBD can be delivered topically to a painful area, say your knee or something like that. And just kind of along those lines, what's interesting about CBD is that it probably doesn't work quite as intimately with the endocannabinoid system in the body as some people might like to believe, but it works on potentially 65 other molecular targets in the body. And one of them is a receptor called the TRPV1 channel. And it's actually the same channel or same receptor that capsaicin, the spicy component of hot peppers, works on. Oh, really? So that's where the pain management effects, at least in part, come into play. What's nice about CBD is that it doesn't have the burning sensation, whereas if you start rubbing like hot peppers on your knee, you would feel it in more ways than one. CBD wouldn't have that same type of effect.
Are you involved now in the development of a CBD product?
So Yes, we have a sister company. BioTrust is a sister company called TrustBo. Bo short for botanicals, and the same principles that drive BioTrust will drive TrustBo. And we have a line of CBD products that are coming out.
And when you say there's a line, so what are the different aspects? Like, so there's different applications. I think you said you could take it orally. I guess you could do a cream. Are there also different qualitatively what's in a product? Does that vary from product to product?
Yeah, I think so. So you have like soft gels that you can swallow, and you have tinctures, which would be in a little dropper that you'd put in your mouth, and then you have edibles like gummies or something like that, and then you have creams. And each one of those presents certain challenges. For instance, in some of those independent studies that they have the JAMA study, which talked about 70% of products not meeting label claims, and there's some other independent studies that some local news channels have done on a variety of products. They find that the edible products tend to not claim what they say they do, in many instances not have anything. So there's delivery may be an issue there, but again, you can test all these things so you can know what's there. A big thing for a lot of people is just going to be compliance. Like, what is the method that you can do and do consistently? If swallowing a soft gel is easier for you to do, and you can do it on a regular basis to get a routine basis to get the benefits, then that's better for you than maybe a tincture, which you don't necessarily like the taste of it or something like that. There's probably different absorption and pharmacokinetic properties to the different delivery methods. For instance, I've seen that tinctures, which basically a tincture, you drop it underneath your tongue,
Right.
and it gets absorbed through the mucosal lining there. And I've heard that the absorption rate is about 5 times higher than an oral soft gel. So a tincture may have some better absorption benefits. So I think it really is about experimentation. I think that there's still a lot to learn. Inhalation is another form, and that's supposedly the highest absorption of any of the methods. With TrustBo specifically, we'll have the tincture, the soft gels, and we'll have gummies and the cream, at least to start with. And then I think because there's such a wide range of potential benefits, what we ultimately will see is some line extensions where there may be a version that is specifically targeted to help promote restful sleep. So maybe there's another ingredient or two that works complementary to CBD and the other phytocannabinoids, and maybe there's something with stress relief. Maybe there's something more with pain management also, because there's some other compounds that can work through other methods, curcumin, for instance, or something like that.
What do you think some of the biggest misnomers are around CBD?
I think you have two camps there. I think that you have people that don't really know enough that think that just associate it with
marijuana,
weed. Yeah. So that's, I think, one of the biggest ones is that it's illegal, that it's bad for you, that it's basically going to cause you to feel those psychoactive properties that THC does. And then you have the other misnomer that it's a cure-all. So I think you have a fork in the road, and they're both extreme. With regard to
so just on that for a second, because a lot of people would start to equate CBD with medical marijuana,
right?
And as if they're two versions of a similar thing, but they're completely different in their application and why you would use it.
Yeah, you summed up perfectly. I think you can use this metaphor. So for hemp and marijuana, they're both from the cannabis family, but they are distinct plants. So it's like citrus. If I told you citrus, that's one family, but lemons and limes are very different.
Right.
So hemp is exactly. They're like lemons and limes. They're very similar. They have some similar compounds, but they're unique. So hemp, again, by law has to have 0.3 THC or lower, whereas your marijuana plant, which is specifically grown for its THC, can have up to 35% THC.
So you from 0.3 to 35%.
Yes.
So that's a pretty big spread.
Yeah. And that's not to dismiss THC or anything like that, but certain people don't want to get into the psychoactive properties. And that's the nice thing about CBD is it's very safe, it's not addictive, it doesn't have those psychoactive properties and things like that. So
yeah, that would be I think probably a big one that's out there. And would you say though that having that 0.3% THC is probably beneficial though? In other words, somehow that maybe is a catalyst for the use?
I think that's a very insightful question. And yes, I do. in general, I think that having the full spectrum of the phytocannabinoids is ideal for overall purposes. I do think that there may be some applications where an isolated CBD may be the right choice. But yes, and in fact, I've used this term a couple times called entourage. So basically what the entourage effect is saying is that these compounds optimize each other. And we see that with one of the first applications of this term, the entourage effect, was that researchers found that, and this was like in the 90s, when they first discovered this endocannabinoid system, which is now being considered the body's master regulatory system, because it controls all the others, they found that there were other compounds that they thought were inactive that were actually potentiating the body's own cannabinoids. And so it's the same kind of thing with these phytocannabinoids, is that they seem to work synergistically. And CBD and THC is a perfect example. If you take THC by itself, the effects are pretty different than if you combine THC with CBD. And so now we go to states where THC is actually legal, you can find varying ratios of CBD to THC. Basically, what CBD and THC do is THC works on this CB1 receptor in the body and has these psychoactive effects, but also has many beneficial properties. But CBD kind of turns down the volume. It kind of blocks the receptor.
It's kind of a modulator.
Yeah, it modulates it, turns down the volume a little bit, so THC doesn't have quite a loud effect, but it also allows THC to last longer in the body. So you get a more muted response that lasts a longer period of time.
Yeah, it's interesting. Well, and this is the whole thing. I think the difference when you look at botanicals in general, or maybe even this particular situation as compared to a pharmaceutical, is that there seems to be an intelligence that's built into these plants.
Yes.
And then when you have the full spectrum, then you're getting kind of the complements of what was intelligently there as compared to trying to do isolates.
Yeah, that's a beautiful way to sum it up. And I think as an Eastern medicine practitioner or something like that, you have that appreciation for it. But in Western medicine, we get very myopic, and we want to look for that one solution.
Right.
And not every time does that go wrong, but many times that leads us down the wrong path.
Yeah.
We already see that CBD has been patented as an FDA drug to treat epilepsy, which is a reflection of its neuroprotective properties, and it's actually quite beneficial in that regard. And that's an instance where CBD itself might be best. But I would agree with you that intelligence that's built into the plant, that anytime that we can nourish the endocannabinoid system with the full spectrum, is likely going to be better off and really enhance the effects of any individual component. And I would actually say that this is just kind of a suspicion of mine. If we look at the research, it's really tricky to identify an actual dosage of CBD that works, so to speak.
Right.
We see studies that are using 300 to 1,000 milligrams of CBD, and then you see a product that contains 15 milligrams of CBD, and it's like, do you even need to? I don't think so. But my point is that I think when you have a full spectrum, you may need less of the one in order to get the greater benefit. But just on the topic of dosage, what I've seen so far is that probably somewhere between 0.67 to 1 milligram per kilogram of body weight per day seems to be somewhere in the ideal range. And because CBD has such a high safety profile, I think it's okay to start at
So it would be kind of a body weight dependent thing, saying
I think so.
How much, and so give me that one more time just so it's clear.
Yeah, so it's somewhere between 0.67 milligrams to 1 milligram per kilogram of body weight per day. So kilogram, most of us take our weight in pounds. Divide your pounds by 2.2, and then you can multiply that number to get it. So an easy example would be someone who's 220 pounds. That's 100 kilos. And so that person probably would be somewhere between 67 and 100 milligrams of CBD per day.
And would you do that all at once, or would you spread that out?
I'd probably spread it out. CBD has a half-life somewhere around 25 hours. So I think that if you can do one in the morning, one in the evening, you'd probably notice the most sustained benefit to it. There may be some specific time applications to it, whereas when you're feeling stressed or feeling anxious, maybe you do it then. But just as kind of a general practice, I would probably spread it out.
With or without food, does that matter?
You know, that's probably still something that we need to better understand, but most of the products are delivered in, if you're doing a tincture or you're doing a soft gel, delivered in an oil format. So these are lipid soluble materials, and so that's what, as long as you're taking it in that regard, you should be fine.
So the quality of the source plant, of course, is important. It's, like you said, you talked about seed, to what was it?
Seed to sale.
Seed
Yes.
to sale.
Yeah.
So it's the quality of the plant. Then the next step has got to be harvesting, right? I mean, how are you extracting? So can you talk about that a little bit?
Yeah, the extraction is a big piece of the puzzle, and one thing that I've heard reported on more occasions than I'd like to admit is that people are extracting the CBD from the plant with paint thinner in their basement, basically. And so just, with any supplement, you have to be mindful of how the material is extracted from the plant. Because, you have this little tiny soft gel that comes from this 20-foot high plant. It's like, how does it get in there? Well, it has to be distilled into something much smaller. And so the extraction process is important. What you use to extract is important. There's really two main methods of CBD extraction at this stage in the game. One is a CO2 extraction, and the other is an ethanol extraction. So that's where the paint thinner might come into play. Not saying that that's something that's common, but it's enough that it needs to be mentioned.
Right.
And so the CO2 is going to be the safest with no residual solvents. So that's something you want to pay attention to, is how is this product being extracted?
How are you guys doing it?
And so at Trustbow, it's through a CO2 extraction. And then, that's a big part of the process, is what's going on there. And then, again, third-party testing comes into play there. So our lab tests the product, but then we send it off to a third-party lab to test. And this is where that QR code comes into play. You'll see a third-party report that says it contains this, doesn't contain this. It's another interesting thing about the vertical integration that we put into play at Trustbow is that we use hand-selected strains of hemp, and so they are resistant to pesticides and herbicides. So there's no pesticides, no herbicides involved at all, which is great, because like we talked about, as a phytoremediator, it would be problematic if those things are in there, if the heavy metals are in there, and so want to test for all those types of things.
You don't want high concentrations of that stuff distilled down into a pill you're going to take.
Right,
Yeah,
exactly.
yeah.
Another interesting piece of that puzzle is something called fresh lock drying, is a aspect of the manufacturing process that we put into play, and that just prevents any mold from going on. So it's a very fresh process, literally taking it from the field and then doing all the extraction, things like that. And all this is manufactured in an FDA registered food grade, GMP certified facility. And another nice thing that I think is worth mentioning is that all this goes on by supporting family farmers in Kentucky. So this is not, just some big, pharma kind of thing. It's, these are people, this is their livelihood, where hemp has been grown since the 1700s in Kentucky. It's one of
the great state of Kentucky.
Yeah, exactly.
That's great.
The bluegrass state. So, and then every product, again, tested for accuracy, for potency, for purity, and has that U.S. hemp seal of approval on it as well. So.
Well, this is certainly a very promising world, a very confusing world.
Yeah.
And I think, like everything else, the people are doing it right. There's going to be a shakeout, and the people are doing it right. They'll end up, kind of on top of this, and all these other, bit players that have come in and aren't doing things right probably aren't going to last very long. But hopefully, people in the meantime are going to figure out where to go to get the right product, so that they don't end up either being disappointed or maybe even injured by it. So
yeah, that's one of the things that I greatly appreciate about this, is that it's our responsibility, the groups that are doing it right, to educate people.
Yeah.
And so that's why I deeply admire what you guys are doing. This is an important piece of that process.
Well, great. Well, Tim, thanks so much for sharing all this with us. I certainly learned a lot, and I'm sure the people who are watching did too.
Thanks, Patrick. My pleasure.
Well, as you can see now, not all CBD is created equal, but you are informed and you can make better choices now. So thanks for watching this interview. It's patient and procedure time. Just be warned, if you're a little bit squeamish, a procedure can look somewhat disturbing to you. So if that's you, just skip that part. Otherwise, let's dig into this. So we're here at Dr. Craig Bueller's office, and he's about to perform a procedure that he's done it on me. It's quite unusual and intense.
and I'm going to have him explain it to you and why he does it. But I know that for a lot of people, it's made a huge difference in their life. So what is this procedure?
It's called nasal specific, and it's designed to manipulate the cranial structure. So medically, they feel that the bones of the skull move or fuse after the age of a certain age, like 21, 22. But if you look at a dry bone specimen of a human skull, you can clearly see the suture lines, and they're very specific. And whether it's a 16-year-old skull or a 50-year-old skull, you can still see those sutures clearly defined. A pledger, an osteopath, developed a craniosacral technique which focused on actually manipulating the cranial bones. So the idea is that when we breathe, the cranial bones actually move. And when a person has a concussion, any kind of head injury, it tends to jam those cranial sutures. And so that mechanism doesn't take place the way it's supposed to. The idea is that the sphenoid bone actually rocks when we breathe in conjunction with the sacrum. That's part of what's considered sacro-occipital technique. That pumps cerebrospinal fluid around the brain and spinal cord, and the pituitary gland sits in a small saddle called the sella turcica. And so that mechanism actually affects the pituitary function. We've had kids come in here that were 14 and 15 and hadn't really gone through puberty or developed secondary sexual characteristics because of pituitary dysfunction. We've done the cranial work on those kids, and within a month or two, they're starting to grow and develop their secondary sexual characteristics. So it stimulates the pituitary gland. We use it a lot for post-concussion syndrome because these patients come in with all the symptoms associated with concussion. And once we unlock that cranium, it's like the switches get turned on. Those symptoms are pretty much eliminated. It's like somebody just flipped the switch back on, and they are different people. It's miraculous. So we use a small finger caught on a sigmoid bulb, and we go inside the nasal passage, which puts it right up underneath the sphenoid bone. It can affect the maxilla, the zygomas, and also the sphenoid simply by inflating and releasing it. So when those sutures get jammed, by going inside the skull and putting pressure, it unlocks. It's minute motion, but it has a significant change in the function of the brain and the whole nervous system. So we have babies that are born with forceps. Their cranial system is jammed. They can't breathe, so they can't nurse. They become colicky. They don't sleep. It's a nightmare for moms. We'll do it on a baby, and it's like the switch is on and they're a changed kid. It's really cool to watch. So that's really the purpose behind what we do. Jason, he's had a lot of problems with TMJ. We've been working to try to unlock some of those cranial sutures. So why don't you explain your history and what you've experienced since we've been doing this procedure?
Yeah, so I've been suffering from TMJ issue that's caused severe pain, discomfort, and my cranial structure not allowing me to sleep, breathe right, pain, all the above. And I've been working with Dr. Buehler and all the things that he said to relieve myself of those symptoms. And so I've been coming a few times, and it's been working very well for me.
So can we see
So
it?
we should do it? Yeah.
Yeah.
Okay. So let me have you lay on your back. Okay. All right, so we're going to go a total of 8, 4 on this side and 4 on this side, okay? So as I insert the balloon, I want you to blow slowly out of your nose. And then when I get ready, I want you to take a deep breath with your diaphragm. Hold it, open your mouth as wide as you can, and stick your tongue out as far as you can. Now the reason I want you to put your tongue out is I want the pressure to go around your soft palate and out your mouth. If you put your tongue back in your throat, the pressure is going to come out through your eustachian tube in your ear, and it's going to hurt, okay? So I'll talk you through it, all right? Here we go. So blow slowly out of your nose. Great. Take a deep breath in. Mouth open wide. Stick your tongue out. Great. Feel that move? Now, patients will actually feel those sutures pop as they unlock. Take a deep breath in, mouth open wide, tongue out, hold it. Great. People with deviated septums, people with sleep apnea, people with migraine headaches. I mean, there's a lot of different applications for this procedure. So many people come in that have had sinus surgery. Take a deep breath in, mouth open wide, tongue out, hold it. And they still have problems. Surgery is pretty traumatizing to people. This is not the most pleasant procedure to have done, but it's a heck of a lot easier than surgery. Take a deep breath in, tongue out, hold tight. Great. Okay. We're halfway through. You okay?
Yeah.
Okay. Take a deep breath in, tongue out, hold it. Great. Okay, blow slowly out of your nose. Take a deep breath in, tongue out, hold it. Great. Okay. Take a deep breath in, tongue out, hold it. One more and we're done. Deep breath, tongue out. Great. Okay, let me have you sit up and blow.
Woo!
You okay?
Yeah.
All right, so Jason, what's that experience like?
Quite a unique experience.
Yeah, it's like an awkward type of a sensation in your head, right?
Yeah.
But you can actually feel like, you know, bones moving around, or a little bit of like a noise, you know, like kind of as things are creaking around in your head, like above your sinuses.
Yeah, like you said, it's a little tiny pop gets in there. Then the pressure kind of goes around, and I feel a lot more open. And
Yeah, I'd say you're feeling relief right now.
oh yeah,
You can breathe better.
when I came in here, I could feel the air hit my, not be able to go through one of my nostrils. And right now, I can feel that it's completely open. So,
Wow, that's great. So you're a veteran. You've been through this a few times now.
yeah.
We work with a lot of elite athletes. Worked with an athlete that, snowboarder, and 8 weeks out from the Olympics in Vancouver, she sustained 3 concussions. And the third one, she ended up being helped off the pipe, and she was in a dark room for 2 weeks.
Wow.
She came in here 3 weeks after the injury, and she couldn't stand on one leg without falling over. So we proceeded to perform this procedure. We did 3 that first week, and at the end of the week, she could stand on one leg with her eyes closed, completely balanced. And I treated her up to the day before the Olympics, and she won a gold medal.
Wow.
So that requires impeccable balance. So to take somebody from that level of distortion and instability to stable enough to win a gold medal is pretty miraculous.
And how common are concussions right now in athletes?
They're
Especially
common.
Even in junior sports or even high school level
Common.
sports, right? Yeah, very
Yeah.
common.
And the beauty of it is you reset that mechanism, the body can begin to heal.
And I was going to say, because what happens is if somebody goes through concussive injuries and they don't get it reset in this way, then the whole rest of their life is just an adaptation to something that's not
Exactly.
right.
Right.
Yeah, so that's very vital that this gets done. Wow,
Yeah.
terrific. Well, thank you, Jason, for letting us observe this.
No problem.
And thank you to Dr. Buehler for sharing your wisdom.
Sure.
Marilyn, thanks for taking time to share your story with us.
My pleasure.
So tell me a little bit about your background. You've worked in the medical field?
Yes, I moved to Arizona when I was 13 years old, and at 14 I started working as a candy striper at a hospital, and from there at 16 I became a nursing assistant. When I graduated high school, I went into nursing school, and after my first year of nursing school I took my LPN board so that I could work the next 2 years as an LPN instead of an aide, and married during that time. And then I graduated from Good Samaritan Hospital School of Nursing as a registered nurse, and have worked in my field, or in the nursing field, for close to 50 years.
Wow. So you then became a patient recently and had some cell therapy. So tell me what caused you to go do that.
I did. From being a nurse, I ended up with bad knees and hips from just being on cement floors all those years. And a little over a year ago, I had a total knee replacement on my left knee, and I've done very well with it. But my right knee was bad, and I started thinking, could I try some other alternative? When I had the knee surgery, there was no alternative. I was falling. It was that bad. It was not stable. So I started researching stem cells, and I spent several months researching it, and then saw the seminar here in Phoenix for this stem cell centers, and I went to it, and I made an appointment here, and then I called several others after I knew more about stem cell therapy. I went on the internet even further and checked out other companies, and decided with this company, and I came in and I had my right knee done first and did really well with that, and then I had both my hips done, and I've done well with that. Not as good as my knee, but well.
So let me ask you about this. So when you had your right knee done, you're talking about you had it injected
Yes.
you with cell therapy. How long was it before you started feeling results?
Actually, well, because of using, the next day it was better even. And then by about a month, I mean, it was really where I could do anything I wanted to do again, and no pain in that knee. I never stop exercising, ever. I work out 4 days a week still, but it was much easier after the stem cells.
And was there an assessment on it? I mean, how was your knee degenerated before?
I was bone on bone.
You were bone on bone?
I was bone on bone in both knees.
And they would have said that this is a surgical case?
Yes, they were ready to say, well, when you recover from your left knee, we'll do your right knee. And I really, as well as I did after the left knee, I wanted to try an alternative first.
Even though the surgery went well for you, it's a tough road, I imagine.
It's a very tough road. The rehab is the hardest part. The surgery you're asleep for, you don't really have any problems with that. The rehab is very difficult, and since most people have total knees when they're older, it makes rehab that much harder.
Right. And then you said, what kind of problems were you having in your hips?
Just arthritis.
Yeah.
I have arthritis in my hips just because.
Was it just aching or?
Pain, sometimes little catching, but it's much better. It's not gone, but it's better.
And how long ago did you have the hips done?
December.
So that would have been just a couple months ago.
A couple months ago.
And is there a possibility that there's still time for them to continue to improve?
Oh, I think so.
Yeah.
They say 6 months to continue, and then I had my knee done in October, so they were about a month apart.
And is your knee still getting better at this point, do you notice? Or you
I think
Yeah,
so. I mean, I'm such an active person that I don't give in to things easily.
Yeah.
So I walk 3 to 3.5 miles 3 days a week. Then I go to the gym and I do a class, and then I do a cardio gym class on a floor, and I don't have any pain in that knee during any of those things, and I did before.
What were your expectations? So did you think you'd get like a little relief, a lot of relief? It would get back to where there's no pain.
Well, I was hoping for a lot of relief. I'm not so naive to think that anything's going to give you 100%, especially when you're older. You've put a lot of wear and tear on your joints.
Yeah.
But I was hoping for a lot of relief.
And at this point, do you feel like that's what you received?
I do.
Yeah.
I do. I'm much more functional, much more comfortable doing what I want to do.
And certainly, without going through surgery.
Absolutely.
Yeah. So anything else that you would share about this that you think people would want to know?
And I know it's not covered by insurance, and I know it's very expensive for most people. I still think it's a great option to try before you go through a major surgery. If it doesn't work for you, and I know it doesn't work for everyone, but I still think it's a great alternative to try for that first. Because if it doesn't work, most all of us have insurance, and you're not going to be paying that much more to have the knee surgery or hip surgery or whatever you have to do afterwards. But I think if you get as good results as I do at my age, you may never need the surgery. And I think that's a real positive thing for people, especially being in the medical field. I can say that with all honesty, that nobody should go through surgery unless it's absolutely necessary.
Yeah, it's a pretty tough road when you start going down
Well,
that road.
there's a lot of risks with surgery too,
Yeah.
and it's not just the surgery itself. You're dealing with anesthesia, you're dealing with a lot of therapy. I mean, you're dealing with a lot of things when you go through a major surgery of rehabilitation.
For sure. Well, thank you very much, Marilyn, for taking the time and sharing your story.
It's been my pleasure, and I hope that I help you all to have more people come and to get, hopefully, insurance to someday cover this for people.
Yeah, it would make a lot of sense, wouldn't it?
Well, to me, it makes like 100% sense because I think they'd spend a whole lot less money in the long run, but not my job.
Yeah, exactly. Thank you very much.
My pleasure.
My name is Michael. My doctor wanted me to give you guys an update from the stem cell therapy I had some months ago. Just so you know, I've been on pain medication since the year 2002, and it just kept getting worse and worse. The pain just kept getting worse and worse. So I researched stem cell therapy, tried it a few months ago. I'm no longer on pain medication. I'm able to go back to work full time. I feel real good about myself. Now, I'm not saying that stem cell therapy is for everybody. I don't know that much about it, but I'm 65 and I'm doing things that I couldn't do years ago. But I know after what all I went through, I'm feeling pretty doggone good, and I'm hoping to get better.
Hi, I'm Patrick Gentempo, host of Pain Revealed. And I decided after my exploration in Pain Revealed, seeing all of the science and research and patient testimonials from stem cells and exosomes, to have exosomes injected intravenously into my body. Now, why? I don't have a specific condition I was trying to treat. I'm actually in pretty good health and didn't really have something that was disabling me from my activities of daily living. But I also just heard about the general health benefits of exosomes. I saw no downside to it, so I decided to go ahead and do that. It's probably about 5 weeks ago or so, so it's a little early to see what the full effects might be. I won't be as dramatic as some of the patients who had serious problems and we're seeing some benefits that we interviewed. But in my case, just a general aspect of health, wellness, and health development and longevity, that was my motivation behind it. I can say that in general, my energy levels seem to be better. One thing I did notice is I use readers when I read, and not that long after I had the stem cells injected, it seemed like I didn't need them as much. So I can't say that this is like, really well objectively measured changes. They're more subtle things that I've noticed, and I'm looking forward to some weeks down the road seeing what else might unfold. But I can tell you it was a simple experience. Certainly it's something that is an investment, but I just felt through our exploration that getting it done was something that was going to be a good thing for me.
Hi, I'm Jeff Hayes. So this is my follow-up video on my stem cell procedures. During this filming, I had two different kinds of cellular therapies and in two different locations. I did umbilical cord stem cells in Costa Rica, where there they can legally do stem cells intravenously. And so I did that. I don't really have any problems that I was trying to fix, but I'm also old enough now that I'm trying to head problems off before they become problems. And so I can't really say I noticed anything major. I'm in really good health, and I'm in really good health after. And so I had. It's hard for me to say, oh, it was this. I had 5 or 6 people over the course of a month later say, wow, have you lost weight? And of course I haven't lost a pound, but they say, wow, you look really good right now. So if I want to, I can attribute it to that, or I'm just, I had 5 or 6 people that thought I used to be fatter. So I don't know the answer to that. Then during this period, I had an X-ray and then an MRI of my neck. And we started to put a disclaimer on my injections in the neck because it's really gross to watch and kind of almost hard to watch. But when I saw the MRI, I had a lot of disc collapse in my neck and had some bone on bone, and so there was a reason my neck was hurting. And so there we used exosomes, and I did the intravenous exosomes in Florida and also did the exosomes in my neck. And that's been about 6 weeks, and I'm doing much better with my neck. I just had a chiropractic adjustment, and they said the ligaments are still loose, so we'll see if that tightens that up any. Also, I had ozone injected in my neck as well, and I've done that twice, and that tends to work really well with stem cells and exosomes. So I've had way less pain in my neck. It's 6 weeks. It's a lot better for just that short period. I also ran into a friend of ours who we had on the series getting injected, a guy named Dave Sinek, and I was just with him in Croatia, and he got his done 6 weeks ago at the same time in Florida, and he said, yeah, I need to record a new follow-up video because he's in the last 4 days the pain was gone. So for 6 weeks he had, just kind of, yeah, that helped a little bit, but it wasn't major. He goes, in the last 4 days the pain was gone. So my advice for anybody who chooses to do this, I've run into people that the next day they felt miraculously better. I've also experienced where I didn't really feel anything for 3 months. The first time I did stem cells in my shoulder, for 3 months I didn't think anything happened, and then after 3 months the pain was just gone. And so I think, I don't know why people react differently, but people react differently to this. And so if you choose to do something like this, make sure you continue to follow up with your doctor and let them know, and hopefully you'll have as good a results as I did. Thanks.
Hey there, my name is Dave Sinek, and I recently received exosome treatment down in Sarasota. I had a strain in my lower back of my multifidus, and I was diagnosed with fatty infiltration of my multifidus. We did the treatment about 6 weeks, maybe almost 7 weeks ago, and it was good. I mean, the treatment itself was pretty not as scary as I was expecting it to be, but I will say that 6-7 weeks out, I don't really feel like I've had positive results yet, though I was told that it would take 3 to 6 months. So the jury's still out for me, but I have high hopes, and that's why I did the treatment. I will say that it's a pretty intense healing process, at least it was for me. The first 2 weeks I was pretty sore and whatnot, so yeah, that's one thing I would definitely recommend people think about going into this, is that it's not just a weekend thing. This will take some time to heal, and yeah, I'm hoping for the best, and I'll check back in again in a few weeks when it's had more time, and hopefully it all works out. But I don't regret doing it though, for sure. I definitely wanted to try it, so look forward to seeing this heal me in a few weeks.
Alright, so this is my 2 month and a week update. There's still some soreness in my lower back, but I just ran at the gym and had no significant issues. I did some work at the AMIT Institute in Utah a few weeks ago, and that seemed to peel back some layers and move some of the irritation around, actually, which I think isn't so much related to the stem cell. I also had some other bodywork treatments, which helped a ton with the issues that I had last time I did my video, where just, digging in a thumb from a professional into some of those spots helped out quite a bit. So it's not been the 3 months yet, still, obviously, as I said, and I think there's still more time to go. I'm feeling pretty confident, though, that by the end of this month, that with some body work and some more dry needling, that I will be pretty much 100%. And I plan on playing some Ultimate Frisbee tomorrow night in my league, which is pretty intense sprinting and stuff without any issues. So things are generally good, and they're trending upward. And yeah, I mean, my sentiment previously about getting some body work on the spots that you get needled, especially because the needle is big and serious, I think that still stands, and that's something I'd still probably recommend if there's soreness. But yeah, I do think that in a few more weeks I'll be good to go, and I'll be doing another update then.
Hi, my name is Dr. Denise Fewich, and I'm recording this because I had exosome IV with Lumostem treatments in early May. The reason I had the treatment was that I was having occasional migraines that were not abating with chiropractic care, my normal course of treatment. I was experiencing probably 1 to 2 per month, and they mostly occurred after long travel and long days. The treatment itself was easy and painless. It was an IV with an IV push of the exosomes, and then the Lumostem followed that, and there was no pain whatsoever. Results that I've had since, I've not had any migraines, which is a really good thing, and I've noticed my sleep is better, and I feel more rested. So that's it.
Well, there it is, right from the real world. So I hope you learned something from that. That concludes episode 7 of Pain Revealed. Really great to be on this journey with you. And if you've already invested in Pain Revealed, again, let me give you my heartfelt thanks. Thanks for believing in us. Thanks for seeing the value in this work. And thanks for helping to support our mission. And if you haven't yet invested in Pain Revealed, let me encourage you to do so. During this viewing period, which is coming to an end pretty soon, you can get a steep discount on the package, and I know this information will be of value to you for years into your future. So again, thanks so much. This ends episode 7. I'll see you in episode 8.
When the pain is excruciating and you want an answer, oftentimes you make wrong decisions, rushed decisions, logic goes out the window when the emotions are high. We know it saves lives. Yeah, it really does. There's such an addiction, and there's such a correlation to pain meds and even heavier drugs like heroin. It's really neat to open people's eyes to the possibility of feeling good without medication.
One of the biggest things that I've found that's overlooked is the fact that if you're in pain, you need all your energy stores to heal that damaged tissue. It's very hard to heal if you don't have energy to heal.
I'm proud to announce that I'm 67 now,
Wow.
and I have had just an amazing journey, and I'm looking forward to another 67 years on this planet. And you start to realize there's certain things that are your weak spot, the spot that's going to hold you back from living life to the fullest.
To have a day with no pain, it made me feel like me again.
Yeah.
And for one day, that was a perfect day. I had no thoughts of ALS at all.